may have noticed this if you've been to a hospital recently. A group of medical organizations recently warned President Biden that hospital emergency departments do not have enough beds for an influx of patients. Analysis from Paul Seegert, managing partner at PCS Advisors. Paul, what's happening?
Well, we have doctors that are sounding the alarm because of a handful of things that are contributing to, and COVID, of course, is part of it, and the payment model is part of it, but contributing to a looming crisis in terms of access to hospital beds through the ER. We've got overloaded emergency rooms, and we also have providers that are suffering from burnout, and we've got even pre-pandemic, we already had a growing shortage of providers, doctors, and nurses. But if in 2021, they did some polling and found out that 68% rather of ER docs said they were suffering from burnout, which often then leads to people leaving the profession. And then 21% of nurses said they intended to leave, with another 29 saying they may leave their positions.
Wow. All right. So when you're experiencing burnout, I mean, this is the job you signed up for. But what's happening here? They're covering extra shifts and things like that if you're a doctor and not getting enough rest and then having to do, complicated surgeries on 2 hours of sleep, something like that?
Well, that's part of it. And there's a staffing shortage, so they're not appropriately staffed. So then you're having to handle a higher workload than you would during the normal shifts that you might be working. So whether you're working more shifts or not, if there should be a team of 8 and you've got a team of 3 or 4, it creates this untenable situation, which is really, that's an issue system-wide right now and is leading to a lot of burnout. And then you have the other issue that you have these misaligned incentives in our system that we've discussed on many of our conversations, and they definitely apply here as well. You've got hospitals that might make more money if they put someone in a bed for an elective procedure than if they admit them to the hospital through the ER for some other condition.
Wow. We're speaking with Paul Seegert, managing partner at PCS Advisors. We're talking about the medical profession warning President Biden of a shortage of ER doctors and nurses. So that touched on, I guess, to a certain extent, the payment model, but what else is there?
Well, you've got the payment model, and then you have staffing shortages that pre-existed COVID. COVID is an element because we overloaded hospitals and ERs, and then you had people that were near retirement that chose to leave the profession. Vaccine mandates came into play. Right. Staffing took another hit, and so it's kind of a perfect storm of a handful of factors. You've got increased mental illness that is driving people into emergency rooms, and they're competing with other conditions to get care. Are there solutions here to any of these problems? Well, the staffing issue is going to take time to work itself out. That's also got another short-term factor in that you can go become a traveling nurse and make $5,000+ a week that used to cost $1,900 a week for a facility. So people are leaving in droves from their home facility to do that. So we have to resolve that, the way that they're paid. But in order to do that, we also have 53% of hospitals that are set to post a loss this year, an operating loss. They're not getting the reimbursements they need. And that would involve what in terms of rectifying that, Paul? Every payer needs to pay their fair share when someone goes in to get care. Right now, government payers expect facilities like these to lose money essentially on their patients. So if you show up at a hospital with Medicare and Medicaid, that facility might need 120 and might need 140% of what your plan paid just to break even. For some procedures, it could be even more severe than that. So the government is essentially looking at these facilities and underpaying, and then those facilities have to turn around and look at employer plans and say, and commercial payers, and charge them significantly more to make up for the shortfall that they're experiencing. That all worked a lot better 20 years ago when two out of 3 of us got our coverage at work. But now with just the way our system has continued to evolve, we passed a pretty significant number. We have 49% of us now that get our coverage at work, 51 who do not. And this dwindling supply of commercial payers provides the profits for the whole system. Well, that's just not sustainable. Thanks, Paul. Paul Seegert, managing partner at PCS Advisors.